36-year-old Christine Nawira is a widow whose husband died of HIV a few years ago. She took an HIV test after her husband's death, and the results confirmed her worst fears.
I
was positive, and because of my low CD4 count, I was enrolled on ARVs.
But Christine's enthusiasm of taking the life-saving drugs was deflated by some patients who bluntly told her that she had signed her death sentence.
When they told me this, I was scared. I even ran away from home.
Off to an island she went for a whole year.
I would only appear at the clinic to pick Septrin, but was afraid of facing the doctor for fear he would give me ARVs instead.
This fear made her make fewer appearances at the health center. Her stepmother, who is also HIV positive, searched for her in vain.
We thought that she had gone just to die from the lake. We had to struggle a lot to see that she comes back and she starts medication.
Stella Kintusi, the executive director of the National Forum of People Living with HIV and AIDS Networks in Uganda, says they receive such disheartening reports from across the country.
And a number of people have been affected because they get scared that indeed the ARVs are going to kill them. Despite the counseling, despite the fact that even those who are scaring them are lining up to receive the ARVs themselves.
I know for sure that many lives have been saved by introduction of anti-retroviral drugs.
The chairman of the Uganda AIDS Commission admits that the drugs, like any other, have side effects. Christine's stepmother, Jessica, experienced some of these.
The fingernails, and they changed the color. My hands also changed to black. The legs, after feeling burnings, it started losing. I could not feel.
Such changes and others she experienced convinced Christine that ARVs were not meant for her. The more she kept away, the more her condition deteriorated.
When she came when she was very weak, she had the meningitis. When she had a problem, her tongue is just in two pieces.
My CD4 count had gone from 200 to 86. I was dying.
When we look at the trends of the number of people dying per annum, it has reduced by nearly 50%. We know that drugs work. It is unfortunate that whoever told that particular patient that the drugs were going to kill her.
Dr. Apuli says that more people are getting started on ARVs, almost 600,000 now.
How come they have not died? They are living longer, they are working.
One of the healthy HIV patients, Christine's stepmother, who is on ARV treatment, convinced Christine of this.
I braved it and went to hospital. I even found my file marked lost and placed among the dead.
I tried to send some of my friends to come to her and counsel her about taking drugs, and they used to come. Sometimes she could disappear from them, sometimes she could respond, sometimes she could ignore them, but time came when she agreed.
This sort of shared responsibility is the clarion call that experts on HIV are calling on everyone to embrace. They want HIV patients to be constantly encouraged to take ARVs and told the truth about the drug's efficacy.
If you are at the stage where you need drugs, please take them and take them regularly. But if you are at the stage where you have not yet, where your immunity has not yet gone low, but you are HIV positive, you can still live well. There are drugs that reduce your chances of getting chest infections, getting tuberculosis, getting other infections in your stomach that normally cause death.
The number of deaths due to AIDS in Uganda amount to almost 60,000 people annually. According to global HIV statistics, about 1.7 million people died of AIDS-related illnesses in 2011. There is a likelihood that a considerable number of people who died were in conditions similar to Christine's. After running away from taking drugs for one whole year, Christine is now a healthier person after she was convinced that the drugs were the only way she could survive. The main concern now is to prevent new infections. Last year, Ugandan authorities indicated that they had reduced new HIV infections by about 20,000.
So we call upon the public to be positive to ARVs, test,
But if that testing is done, with American money that is funded almost 80%, and it has flattened, and now we have this heavy increase of those who are needed this treatment, then where the money is going to come? We know Global Funds were working very hard. We appreciate their effort. We know Irish Aid and others, but we cannot leave a heavily disease like this into the hands of foreigners.
The UNAIDS country coordinator says the recent testing by President Museveni could see to a tremendous uptake of HIV testing across the country. He adds that if 15 million Ugandans were to get tested, about 400,000 of them may be found to be in need of HIV treatment by the end of 2014. The experts' rallying call is that the country had better be ready to take care of its people, and the people had better be ready to embrace the treatment. Florence Naluyimba, NTV.